insurance rates based on safe driving habits. Now that's Progressive. Learn more at progressive.com or 1-800-PROGRESSIVE. And by Fidelity Wealth Management, providing perspective on a client's entire financial picture. Investment minimums apply. Fidelity Brokerage Services, LLC. And by C3.ai. C3.ai software enables organizations to use artificial intelligence at enterprise scale, solving previously unsolvable business problems. Learn more at C3.ai.
Now checking in with Black-owned farms, many of which have struggled over generations. So many have disappeared. Our story's from North Carolina, where some Black millennials have been going back to their family farming roots. Here's WUNC's Leonida Inge.
Julius Tillery is a fifth-generation cotton farmer.
You can call me the Puff Daddy of cotton. People like to call me that.
After graduating from college, he worked in rural development and conservation, but really wasn't getting his hands dirty. He decided it was time to go back home to Northampton County to help his father at Tillery Farms.
So, I looked at what my great-grandfather was able to do and grandfather and even my father, utilizing cotton and keeping our family farm going. So I want to make sure that we change the narrative where people can see pride and ownership around cotton.
So now the 34-year-old Tillery spends a lot of time packing and shipping boxes from his online business, Black Cotton. It turns cotton bolls from a small patch of the farm into wreaths, bouquets, and other home decor. Just over 100 miles away is the Tallgrass Food Box, run out of Durham County. When schools, restaurants, and farmers markets closed in the early months of the coronavirus pandemic, it was especially hard for small Black farmers to sell their food. Gabrielle E.W. Carter and friends jumped into action. The 30-year-old helped connect Black farmers with customers by creating an online service.
Very fulfilling for me personally, just kind of reconnecting to some of the work that I feel like Black people have, Black women in our communities, especially thinking about my grandmother, like this is the type of work we do a lot of times.
The Tallgrass Food Box uses a simple model. People go online and pay $50 for a box of fresh goodies, like collard greens, sweet potatoes, mushrooms, whatever is coming out of the ground. Anna Huckabee, who owns Moonlight Farms, says the boxes saved her business.
It's just been great ever since. Just so much exposure, just being with them.
By the end of December, Tallgrass had raised $80,000 for Black farmers in their community. In Durham, North Carolina, I'm Leonida Inge for Marketplace.
Our producers are Meredith Garrettson, Stephen Ryan, Daniel Shin, and Erica Soderstrom. I'm David Brancaccio. This is the Marketplace Morning Report. From APM, American Public Media.
Feeding Northeast Florida reports 1 in 6 seniors are faced with hunger. Many are forced to forego food to pay for prescriptions or medical care. For information on how to help, feedingnefl.org.
Wayne Hogan of the Terrell Hogan Law Firm.
I'm Wayne Hogan. A company's cell phone policy can protect your employees and your bottom line. Our distracted driving presentation for the workforce can help.
Learn more at waynehogan.law.
Baptist Health and Wolfson Children's Hospital are here for children in or at risk of a mental health crisis. Our 24/7 Kids and Teens helpline is staffed by mental health experts and available to parents, kids, and teens. Call 904-202-7900.
This is WJCT News 89.9 Jacksonville. Ahead in the next 5 minutes, live local news for the First Coast from the WJCT News team.
From politics and public affairs to arts and entertainment, First Coast Connect connects you to everything that's happening across Northeast Florida. I'm Melissa Ross. Get plugged in as we interview the most compelling newsmakers of the First Coast. Keep listening as we take your calls. Get on the line now, join the show, and be part of the conversation. The number to connect is 549-2937. You're just ahead on this hour, here on First Coast Connect.
after the day's news.
Live from NPR News, I'm Corva Coleman. President Biden plans to sign a series of executive actions today to reverse some of the hardline immigration measures of former President Trump. NPR's Franco Ordonez reports this includes launching a task force to reunite children separated from their parents after crossing the border.
The new White House is under increasing pressure to make good on election promises to do more for refugees and undocumented immigrants. Much of the attention will be on the task force's challenging job finding missing parents of hundreds of children despite limited records. A second action will study how to replace a program that required migrants seeking asylum in the United States to wait in Mexico or another third country. A third directive includes reviewing Trump's public charge rule, which prevented immigrants from getting permanent residency or green cards if they had or were likely to require public benefits such as housing subsidies. Franco Ordonez, NPR News.
Former President Donald Trump is facing a deadline today to file a formal response to his impeachment charge. NPR's Windsor Johnston reports his Senate trial is scheduled to start 1 week from today.
Trump, who has struggled to put together his legal team, has until noon Eastern Time to file a response to the impeachment charge. The former president is accused of inciting an insurrection for his role in last month's violent attack on the U.S. Capitol building. Trump is expected to argue, still without evidence, that the election was stolen from him.
NPR's Windsor Johnston reporting. With millions of senior citizens eligible to take a COVID-19 vaccine, many of them continue to struggle to locate the shots. Will Stone has more.
The supply of vaccines is not nearly sufficient to handle the current demand. Many states have now made those who are 65 and older eligible for a vaccine, but cumbersome online scheduling systems and overwhelmed phone lines have frustrated some seniors. Bill Walsh is with AARP.
It's unconscionable that we can't do better.
The patchwork of rules around who is eligible and how to sign up has complicated efforts. The Biden administration says the supply of vaccine will increase and that will help get the shots to more seniors. But state leaders caution demand will continue to outstrip supply for weeks. For NPR News, I'm Will Stone.
Actor Hal Holbrook has died. His daughter announced the news on social media on Monday. The New York Times reports that Holbrook was 95 years old and died on January 23rd at his home in Beverly Hills, California. No cause of death has been given. Holbrook was a renowned character actor in films and on television. He was best known for his one-man show, Mark Twain Tonight. He performed it for decades, winning a Tony Award. Holbrook also earned Emmy Awards. You're listening to NPR News.
It's now 4 minutes after 9 o'clock. This is WJCT News 89.9 in Jacksonville. NASA will once again test the 4 engines of its next moon rocket, SLS, ahead of a planned launch from Kennedy Space Center. As Florida space reporter Brendan Byrne tells us, the redo comes after a previous test ended prematurely.
The plan was to fire the SLS's 4 main engines for up to 8 minutes, simulating the first phase of the planned launch. But instead, an onboard computer shut that test down after only 67 seconds. Boeing, the core stage's main contractor, examined the vehicle and said a second test poses minimal risk and will provide NASA with crucial data for future SLS launches. NASA says a redo of the test could happen as early as late February and is targeting at least 4 minutes of engine firing. Once complete, the SLS core stage will head to Kennedy Space Center to launch the Orion capsule on an uncrewed mission around the moon and back. It's unclear if the redo will impact SLS's launch, which is over budget and behind schedule, although NASA is currently targeting a launch no earlier than November. I'm Brendan Byrne in Orlando.
And this morning, Pennsylvania's own world-famous groundhog, Punxsutawney Phil, saw his shadow, and that predicts 6 more weeks of winter. And we are off here in Northeast Florida to a very cold start. It feels like temperatures are in the 20s. Right now, it's 39 degrees here downtown. It should gradually warm up. The sun's already starting to come out. We'll have a high today near 51 degrees. Mostly clear and plunging back to the low 30s tonight.
Support for NPR comes from NPR stations. Other contributors include Capital One with the Capital One Venture Card. Details at CapitalOne.com. What's in your wallet? Credit approval required. Capital One Bank USA NA. And the listeners who support this NPR station.
Is access to the COVID-19 vaccines equitable? This is First Coast Connect. I'm Charles Griggs, sitting in for Melissa Ross. Thanks for listening. And just ahead, while some are saying the needs of certain communities have not been addressed in the state's COVID-19 vaccine rollout. The number to call is 549-2937, or you can tweet us at WJCT News as well. Then later, a preview of the players and how it will differ from previous tournaments. But first this hour, the latest on the coronavirus pandemic. The health department added 5,730 coronavirus cases across the state in Monday's report, bringing the cumulative total to 1,727,107. The state also reported an additional 206 resident deaths, bringing the cumulative total to 26,685. And Duval County again recorded one of its deadliest days from the coronavirus, with 16 more deaths reported Monday, raising the county's toll to 927 since the start of the coronavirus pandemic. And speaking of the COVID-19, according to the CDC, Black Americans are 1.4 times as likely to contract coronavirus as their white counterparts, and 2.8 times as likely to die from it. As the nation continues to roll out vaccine distribution efforts, Black and Latino Americans are dying of COVID-19 at 3 times the rate of whites and being hospitalized at a rate 4 times higher, according to the U.S. Centers for Disease Control and Prevention. A CNN analysis of data from 14 states found vaccine coverage is twice as high among whites on average than it is among Blacks and Latinos. The analysis also found that on average, more than 4% of the white population has received a COVID-19 vaccine, about 2.3 times higher than the Black population itself and 2.6 times higher than the Hispanic population. Health advocates blame this disparity on federal government and hospitals not prioritizing equitable access to the vaccine. However, Governor Ron DeSantis says disparities are not based in race.
Community sites, the Publix, the hospitals, just to be clear, there's not any type of racial discrimination. They're not accounting for race. It's all based on age, regardless of any of that. And that's obviously the way it needs to be.
So locally, concerns over these disparities prompted Black leaders to send a letter to Mayor Lenny Curry asking for increase the number of vaccination and testing sites to be expanded, ensuring the communities, quote, ensuring the communities of color within the city are adequately covered, end quote. So why are we seeing these disparities, and what can be done to help rectify them? The number to call again is 549-2937. Joining in our conversation today. Joining me for the discussion also is local immunologist Dr. Suni Joshi, and he's on the line with us. Good morning, Dr. Joshi.
Good morning, Charles. Thanks for having me.
All right, and thank you. And also Dr. Rogers Kane, president of the Northeast Florida Medical Society Foundation. He's joining us as well. Good morning, Dr. Kane. Good morning, Dr. Kane.
Good morning, Mr. Griggs, and good morning, Dr. Joshi.
Thank you very much.
Good morning, Dr. Kane.
Let's start with you, Dr. Joshi. We heard Governor DeSantis' response to the question regarding race, and we've also seen that the governor has expanded or implementation of vaccine distribution through Publix stores throughout the state. What are your thoughts on this plan and how distribution can be more equitable throughout the community?
Yeah, I mean, and so when the governor was asked about that yesterday, he was basically answering the question factually, in the sense that when people go to a location to receive the vaccine, whether they go to a hospital or a Publix, they're not being asked what race they are, and they're not being excluded that way based on race. That's a direct answer to the question. But the issue is what is embedded in the systems that have been put in place is the unintended consequences of racial discrimination, in the sense that because, let's say, for instance, public sites are what we're using, we all know that Publixes tend to be in wealthier communities, and they tend to stay out of the underserved regions. And in particular, that's the case here in Northeast Florida, where we have food deserts in those areas too. And what's interesting is where you have a food desert, you also have a pharmacy desert. So you don't have the pharmacies there either. And so when you start to say, okay, here's how we're going to get this vaccine out to the vast majority of Floridians, you're leaving out a very important group of Floridians in the process. And those are the ones that live in the underserved areas that also have issues with transportation and the ability to get online to make those appointments. It becomes unfair to that group of people. And in that case, that's this embedded racism that people just don't see until you look at the big picture.
So with that being the case, what would be the rationale for using a plan that systematically sort of left out large portions of the community that you would have to figure out a way down the road in order to address?
And I think what happens is you're looking, when you don't plan far in advance for these types of things, you're looking for quick fixes. Okay, we need the pharmacies to do this. The pharmacies have the infrastructure to provide vaccines. They do it all the time. Let's get them the COVID vaccine. And without thinking about the unintended consequences, I think if we're always looking at how does this affect every part of our community, in particular the parts of the community that are more likely to develop COVID-19, more likely to be hospitalized due to COVID-19, and more likely to die from COVID-19, then you are indeed contributing to the disparity. If you're able to include those people in the conversation, then we have a chance to make it work. And it doesn't have to be done just through private pharmacies. It could be done in a variety of different ways.
Okay. Lizzie writes the show and asks, I heard yesterday that 47% of the data on ethnicity and race on COVID vaccinations is missing. Is this true? Can this information be retrieved? What policies will be changed to address disparities in Florida distribution and vaccination? Dr. Joshi, do you see that there's data missing, and if there is, how useful can that information be with putting together a more robust plan for vaccine distribution?
That's a legitimate question, because I've taken my dad and my elderly aunt and uncle to get the vaccine, and in the questionnaire there's a box for ethnicity. And it basically, one of the boxes says unknown, and I do feel like quite a few people are checking that unknown box, and so when you do that, obviously that skews the data, and so to some extent it's hard to use that data to know what percentage of the population is being vaccinated, but that's really all we have to go by right now, and maybe we need to change how we record ethnicity and racial groups with the vaccine. But that is definitely an issue. It's a good question, and that does tend to skew the numbers a little bit and make it a little bit harder for us to understand trends in terms of vaccination rates.
Okay. Dr. Kane, you co-authored the letter to Mayor Lenny Curry stating your concerns regarding COVID-19 vaccination efforts. In the letter, you stated the COVID-19 pandemic, I'm quoting here, continues to expose the failures of our public health systems, the pervasive structural and institutional racism that permeates our community, and the inequities that confront us. What did you mean by this? Are you trying to address a broader issue of public health concerns, or are you being more specific to the COVID-19 vaccine issue?
No, thanks for asking the questions. I really do think that we're not only addressing the COVID issue, but also the broader issue. I think COVID just served to pull back the covers on that broader issue of institutional racism that exists in our current healthcare system. There's no health equity in terms of community access to therapy, treatment, and in this case, we're looking at vaccination and or treatment. When you take a look at the fact that the health department has been defunded, and the health department, and I guess Department of Health for Florida, for years there has been a steady decline in the funding, and it very much limits the well educated and well intentioned individuals that work at the health department in terms of trying to stay in touch and keep track of the what's going on in the community and to help fairly distribute health treatment and therapy within our community. So it's bigger than just COVID, but COVID is the most immediate concern. And again, as I said, COVID just pulled back the covers on the institutional racism that has been experienced in this community for some time.
Okay, so you all particularly, I'm speaking about the NAACP letter that was co-authored by you and Isaiah Rumblin, Dr. Carol Neal, and Dr. Richard Danford of the Urban League. Your intent was to raise this concern with the mayor. Did you communicate that with the governor as well? And if not, what is your intent? What do you expect? Your expectations to hear back from the mayor's office on this?
Well, no, we did not directly go to the mayor from our local standpoint. I think my intent with the mayor and other city leaders is that they were elected to look out for what's best for the Northeast Florida community, being, in this case, we're talking Jacksonville, obviously, but the Northeast Florida community. And we're not saying that not only only African Americans are not being served well, other communities of colors, and I do think much of Jacksonville is not being served well. When you have publics, predominantly public that are getting the vaccines are those in St. Johns County, it becomes inherent upon the city leaders to step up and go to battle for us to with the governor as to making sure we get fair access and a fair distribution of vaccine to us in this county. So it's not just African Americans that we were looking at. We're looking at the entire Jacksonville community.
Okay, Dr. Josie, how would you advise local governments or the state perhaps on this vaccine distribution plan to address those concerns which you've stated and what Dr. Kane has stated as well related to these disparities? And it appears that because of the way the distribution is being rolled out, the outcome it looks like it's based on race. And the governor has said that's not the case. But what would you advise them to do in order to fill that gap so that the intent or the outcome it doesn't seem like it's based on race?
Yeah, that's a great question. And so I do think this comes back to the state level in this particular case, much more than the local level, because I feel very strongly that the city of Jacksonville wants to get the vaccine out and wants to get it out into the underserved communities when they have the supply. The issue is clearly the supply. So number one, we need our state leaders to be able to get us the supply that's necessary. Now, they need to get that from the feds, but once they get that, that's very important that the state rolls that out appropriately to the larger communities in Florida. The Jacksonvilles and Tampas, Orlandos, and Miamis need to get a very large percentage of this vaccine to be able to vaccinate its citizens. But in the process, we have to not just focus on Publixes and the large private pharmacies, because it's not just Publix. This is not a Publix discussion. It's CVS, Walgreens, all of those. Even most of the Winn-Dixies are not in the areas of our underserved communities. So we need to have a plan in which, when we roll out larger numbers of the vaccine supply, so that we go to small private mom-and-pop pharmacies that are located in some of our underserved areas. These men and women want to serve their community, and the men and women of those communities trust their pharmacies and are more likely to go to those pharmacies to receive their vaccines. They should also consider getting them into the church groups and the not-for-profits that are in those regions. And I shouldn't say consider, they really should do it in the same level that they're doing it at some of the private pharmacies, so that there's large numbers of supply of the vaccine available for the underserved communities. And it's not just a one-time thing. They're going to get it the next week and the week after that and the week after that. I mean, if there's vaccine left over after the demand in that community is down, then that vaccine can then be distributed to the other parts of town as well. And it needs to be publicized appropriately. I've heard many stories in the last 2 days about how, well, this church was able to give the vaccine and this pharmacy gave the vaccine. Well, I think the state needs to do a better job of letting people know that these vaccines are available to the underserved communities in these locations, and this is how you can get the vaccine instead of it being something that you hear through the grapevines. I think that's one way to make it work. Then also make it easier to schedule appointments. I mean, you're already at a huge disadvantage if you don't have internet access or if you don't have transportation, because right now in most of the state-run sites, it's first come, first serve, or by appointments in which you need to have internet access. That becomes very difficult for folks who don't have that ability. Right there, the ball's in the other person's court immediately, and you're already losing by 10 points before the game starts. I mean, it's almost impossible to make it work for you if the 8 ball's against you at the very beginning.
Okay. Let me take a moment to reintroduce both our guests. Dr. Suni Joshi is a local immunologist, and Dr. Rogers Kane is the president of the Northeast Florida Medical Society Foundation. And we're talking about disparities in vaccine distribution in the First Coast area. Also, we have a question here that says, actually, I'll go to a phone call here. Stanley is on the line right now. Stanley, good morning.
Good morning. How you doing?
All right.
To everybody. Yes, my concern here, we know that there's a problem in this country when it comes to racism for 400 years. Why when things happen to the African American community, it's always reactive? It's not proactive. We should have been addressing this issue 6 months ago concerning, and I hold the African American community responsible. I'm talking about the leadership. The leadership is always, as I mentioned, reactive to what takes place in this country. Plus, the African American community is not educating the community. We have the problem because we talk about all the when the issue comes to that African Americans has been mistreated in this country, that we do things for ourselves, especially when it comes to education here. Those same leaders that just mentioned, they should be out in the community, educating the community from day one, because we have a history when it comes to mistreatment in this country. Sorry about that.
That's okay.
But thank you for this opportunity.
Thank you, Stanley, for your comments. And Dr. Kane, I want to talk a little bit about trust in this situation, because Stanley brings up a good point around education. Some people believe that one of the reasons why African Americans are not getting vaccinated at a rate that other communities is because people just don't want to get the vaccine. They don't trust the process. They don't trust the vaccine for a myriad of reasons. How are you and your organizations plan on dealing with that? Are you providing any education or any opportunities to educate on that, or are you advising local elected officials on how to address those issues? What do you see on the horizon for helping to build trust around the vaccine distribution?
Okay, that's a twofold answer. Yes, we are, as a group of black physicians especially, but we also have black nurses and the black pharmacists. We are reaching out and we are also recruiting the Pan-Hellenic Council. We're reaching out, educating patients, whether it's by Zoom, every opportunity we get to discuss the need and the trustworthiness of the black vaccine. We do that. Now, the problem is we're not being consulted on a plan as to how when the vaccine does become available, because I can agree with Dr. Joshi, that we don't, vaccine supply is the most immediate problem that we have. But when the supply starts to roll in, we don't have a plan, and most of this has been within the black community because they got the hookup with someone locally. Whether or not it's their pastor, whether or not it's myself or someone else who know about a vaccination event that is occurring, and then we let them, we have to spend a whole lot of time running around trying to call patients to make sure they get to the vaccine site. there is a level of distrust, but when educated on the trustworthiness of the vaccine and the deadly effects of the COVID virus in itself, most of my patients, after discussion with us, will go and get the vaccine. So if given that opportunity to address the city in terms of what their plans are in terms of vaccine distribution once we get that supply, we will do it. So I think that the city needs to make sure that they have individuals in their planning sessions like Dr. Joshi and or myself or some other African American physicians. They need to be on the planning. Physicians need to be on the planning committee as to how the vaccine distribution should occur. And the vaccines can also, just to hop on something else that Dr. Joshi had mentioned, there's no reason that, we need to examine how can primary care physicians also play a role in distributing or providing that vaccination site. So, we'd be willing to do it as given the proper equipment and educated on how we can help this roll out and make sure we comply with what the state wants us to do. So there are a lot of avenues that we haven't even begun to address in terms of bringing the vaccine to the community instead of the community having to go to the vaccination site.
Okay. There are many people working on vaccine distribution, and there are already efforts underway, as we talked about earlier, to make sure the vaccine is available to the community. We want to make sure we give out the number to those people who meet the criteria to receive the vaccine. The number is 1-866-200-3762. That's 1-866-200-3762. And that's the number to the Regency vaccine site. And you can set up your appointment based upon your eligibility to get that done. And in the meantime, we'll continue to try to educate the community on the best ways and the best strategies to get the vaccine to them. Dr. Joshi, again, what we'd like to try to do is to dig a little deeper into why, how we can better support our communities in terms of vaccine distribution. And I know that Dr. Kane just talked about a little bit about being engaged and involved in those planning opportunities that the city leaders are engaged in on a day-to-day basis. Is there anything that the community can do without being engaged and involved in those planning opportunities that the leadership are putting together to help bring more people closer to receiving the vaccine?
Yeah, absolutely. So people, in particular, men and women in the underserved communities, number one, getting the word out about the safety of the vaccine, the effectiveness, and how it is very likely to prevent hospitalizations is important. But as Dr. Kane was saying earlier, there's no reason why we can't have a group of volunteer nurses and doctors who are willing to help provide the vaccine at some, whether they're city-located sites or even church sites or not-for-profit sites or just big old parking lots at Edward Waters College, places like that have the space and the infrastructure to provide vaccines, is to develop a plan in place so that when the city does have a larger supply of the vaccine, they can go to the city can come to them and say, hey, we are ready to give this out into the underserved areas. Where can we do it? And we already have a plan in place of where it can be done. The locations have agreed to do it. The volunteers have agreed to do it. Let's just make it happen, as opposed to waiting until we get that large amount of vaccine. And now, okay, we need to get it into our underserved areas. Let's try to get it to work now. That's how things become confusing. That's how people get frustrated. That's how people end up waiting in line for hours. We should have a plan in place so that when that vaccine is available in larger supply here in the city of Jacksonville, that we can get it out to the communities that need.
Okay. Well, we're going to continue to monitor this situation, and we know that both of you are going to be working to continue to educate leaders and the community on the best ways to close the gap and disparities related to vaccine distribution. Dr. Suni Joshi, thank you very much for being here. And Dr. Rogers Kane, thank you very much for your time. We appreciate your time and efforts in the community and as well.
My pleasure.
Okay.
as well as mine. I would like to say real quickly, if we can, I would like to have our community leaders, the city council, and others to vocalize their concern, much like they did with Lot J, in terms of helping this community. So if we can recruit them in terms of making sure that vaccine distribution occurs within the within the north side as well as other sides of town, we would much appreciate it.
Okay. Well, thank you for your leadership on that.
Okay.
All right. All right. Much more coming up later. An update on the players, which is a little more than a month away, believe it or not. But up next, a new treatment for COVID-19.
The military in Myanmar declares a state of emergency to last 1 year. A coup this week sent government leaders to jail and democracy activists into hiding. Now many are wondering how or even whether to resist the military. One big question, what kind of support can activists expect from the Biden White House? How the coup happened and what may happen next, that's on The World.
Tomorrow at 3, here on WJCT News 89.9.
China's manufacturing sector is growing pretty good. American factories, on the other hand, not so much.
I'm not especially worried that, my tennis sneakers are made in China. I am concerned about the future of the aircraft industry, of the telecommunications sector.
I'm Kai Rizdal, both sides of the all-important Sino-American manufacturing relationship. Next time on Marketplace.
Tonight at 6, here on WJCT News 89.9.
Welcome back. There's a new treatment for COVID-19 called BAM Fusion. Melissa Ross spoke with Dr. Fred Jenkins, Director of ER at Memorial Hospital in Jacksonville.
Hi, Dr. Jenkins. Thanks for being with us.
Thank you for having me. Good afternoon.
Good to talk to you about this. Tell us what you know about the new variant or strain of COVID-19 and how that is affecting public health here on the First Coast.
Well, so actually there's more than one variant strains that are out there right now. As you know, a variant strain is a mutated form of the original coronavirus. And when you have mutations to the genetic material, that results in changes to the virus itself, to the proteins that are on the outside of the virus. Of the three variant strains that are really important right now, the B117 strain is what's known as the UK variant. That has the most activity worldwide and in the United States. It's been reported in around 50 countries, and then I calculated around 31 of our states have reported the B117 strain. Actually, on the CDC's website, Florida has reported the most number of cases in the United States. Now, most of these are to the south, in South Florida, but still quite a lot of activity. One good thing about this strain is so far our vaccines, both the two that have approval and the other ones that are kind of reporting data right now, appear to be effective against it. We have the B1351 strain, which is the South African variant, and this one's a little bit more concerning. Last week there were 2 cases reported in South Carolina and 1 in Maryland. And what makes this one more concerning is that it appears to be a little bit shiftier. So the vaccines that are currently reporting clinical trial data, the Johnson & Johnson vaccine and the Novavax vaccine, definitely show diminished effectiveness against the B1351 strain, and so that's concerning. Then there's the P1 strain, which is the Brazil strain, and there's been 1 case reported in Minnesota for that one.
So is all of this translating to a rise in COVID patients in your ER or not?
Well, so we can't say that it's definitely attributable to variant strains. We in order for us to know this, we have to really kind of ramp up our genomic surveillance nationwide and in Florida, and we're doing that. I know that Biden in his 1.9 trillion COVID Relief Act has proposed increasing funding for this, so hopefully that will result in better surveillance for them. What I can tell you about the cases, though, is we are in the middle of a big third wave of COVID now. We kind of peaked in mid-January, and at least as far as new cases go, both nationwide and locally, those have come down some off of their peak of a couple of weeks ago. The U.S., the 7-day averages in mid-January were, roughly 250,000 plus cases a day, and that's come down to around 150,000 a day right now. In Duval County, we were, up to around 1,000 new cases a day a couple of weeks ago, and we're less than 500 right now. We still are seeing a lot of burden from this. So the death rates are still very high nationwide, still over 3,000 cases a day. So still very, very concerning.
Yeah. Now, there's this new treatment that you're offering at Memorial called BAM infusion for COVID-19 patients. What is BAM infusion therapy?
Yeah, bamlanivimab is a monoclonal antibody, and so monoclonal antibodies are synthetic antibodies that are functionally similar to our own natural antibodies. And what they do is they attach to the virus. In this case, to the spike protein, which is that sort of prong-shaped protein we're all familiar with seeing in the graphics of the COVID virus. And by doing that, it makes it where the coronavirus cannot enter our cells and do damage. And so BAM is approved for patients who are high risk, but who are not yet sick enough to be in the hospital. So we don't use it on inpatients. It's an ambulatory treatment only. The high-risk criteria that we have, and I just want to make sure that I get this out there so that anybody that's listening to this and any primary care physicians that might be listening, the high-risk criteria are patients with a body mass index of greater than 35, chronic kidney disease, diabetes, immunocompromised. If they're greater than 55 years old and they also have concurrent cardiovascular disease, hypertension, or COPD, or anybody that's over the age of 65. These are all candidates for bamlanivimab therapy if they've been diagnosed with COVID-19 and they've been symptomatic for 10 days or less.
Okay, so only certain patients. As the vaccine program rolls out at hospitals around the region, although it has been shifting more to state-run sites, tell us about the vaccinations that are happening at Memorial Hospital and how you're seeing that unfold.
So we started vaccinating healthcare providers back in December, and it's been a tremendous success. We've vaccinated several thousand people. We've done both the Pfizer and the Moderna vaccine, and it's been an amazing success. It's really opened up a ray of sunshine and hope for all of us. And one thing I would like to say is we're going to be doing our final community healthcare provider clinic for vaccines on Wednesday from 8 a.m. to 3 p.m. And in order to, if you're a healthcare provider, it's first come, first serve. You'll need some type of identification that identifies you as a healthcare provider. But this will be the last day for first doses of the two-dose vaccine regimen.
Last but not least, as people get vaccinated, they should keep wearing their masks, correct?
Absolutely, absolutely. What the clinical trials have shown us is that the vaccines are highly, and I mean incredibly effective, actually, in preventing symptomatic COVID-19 infection and preventing severe illness. But what we don't know is how effective they are at preventing asymptomatic spread. So it is possible to still spread the virus even though you yourself have been immunized against it.
Dr. Fred Jenkins, directing the ER at Memorial Hospital in Jacksonville. Thanks, Doctor, for being with us.
Thank you. Thank you.
Thanks, Melissa. The Players is just over a month away, believe it or not, and it will look a little different this year due to the pandemic. The tournament's executive director, Jared Rice, is on the line now with more on that and what fans can expect. Good morning, Jared.
Well, Charles, how are you?
I'm doing fine. Thank you for joining us this morning. And so, what will be the most glaring changes in this pandemic season that fans can expect?
Well, again, I appreciate you having me on, and this is certainly a very fluid and ever-changing situation, and those are things that we're all facing. And certainly, this event is a signature of the First Coast, and we've been thinking through for a number of months all the ways that we can deliver it with the health and safety of all involved being the number one priority, and considering how we can responsibly do that. And in terms of some of what people can expect to be different this year, I think first of all there is a limited capacity that we feel is again the responsible decision, and we are going to have about 20% of our typical max capacity out at the Players. And as part of that, we've made a host of modifications to the guest experience while still staying true to the things that our community has come in to know and love about the Players. And by that I mean we will have protocols like we call the 3 W's, and that is wear a mask, wash your hands, and watch your distance. And those are things that we're going to ask people to be mindful of and represent when they're out on course. We do have a contactless experience, so that means we've have digital tickets and digital parking passes and contactless commerce on site. And we're doing those things, again, in a way that still features tremendous golf, and that's great athletic competition. From an on-site perspective, we will continue to have some level of local restaurants available out there for fans to enjoy. But I said it will look different, and with a limited amount of people, that will certainly feel that way. But I think the community has a great opportunity to show the world how we can responsibly support this event, and that'll come through in our telecast.
I would imagine that many of your adjustments have been inspired by adjustments and changes that have been implemented during other PGA events. How have they been working on the whole across the tournament landscape, and what do you see for the future of how these new changes will be implemented going forward post-pandemic?
Sure. Well, I think for many of our listeners and those this morning that we all knew it was Thursday at Players last year where our worlds really did change. And I think as you consider the home of the PGA Tour being here in St. Johns County and Ponte Vedra, the idea of how we could stage the event with no fans was something we had really built out on Thursday afternoon, when at that point we had made the decision to host the tournament with no fans at that point. And really that became the foundation of how we thought about bringing the sport of golf and PGA Tour golf back in June. So again, what the answer to the question is, it's what I think is really interesting is that the path to coming back really started that afternoon, even though we ended up canceling the Players. And so the PGA Tour has been back for about 40 weeks, starting in June at the Charles Schwab event in Fort Worth. And over that period of time, we're very fortunate to have the resource of the PGA Tour and working very closely with our colleagues to make sure that all the things that are important to delivering a safe environment can be applied here at the Players. So we're as you would imagine, we're leaning into that expertise, and we're really looking forward to being able to have the event here in about 40 days.
Okay. So for those fans that are looking to be able to attend, how will they be able to get tickets specifically, and what's parking going to be like? I know that a lot of this information is available on your website, but I think that people probably like to sort of hear it directly coming from the top. It's not going to be difficult. It's just going to be different, correct?
Yeah, I think that's a good way to put it. It is going to be different. And, our ask would be that this is, we're doing these things in a way in which we can continue to provide, economic and charitable impact to the community this year. And, the telecast is a huge promotion driver for our region. And, how we want to be back to the pre-COVID experience as much as all of your listeners. And, it is going to be different this year. And, being able to understand that and understand the greater good as an attendee, we appreciate and the patience that it may take to do that. But when you think about your experience, you're right, theplayers.com will show all the ways in which you can access the property. We do have some very few amount of hospitality tickets still available. We will go on sale with a limited number of grounds tickets or general admission tickets that we call stadium passes. Those will be available on February 16th. And we have had started yesterday some what we call pre-sales, and those are opportunities for people that have purchased tickets in the past and been a part of the tournament in the past to get to access to, again, some tickets before they go on sale to, let's say, the general public on February 16th. But to be clear, there will be tickets available on the 16th, and the best place to get all that information is on theplayers.com. You're exactly correct. Okay. We will have parking on site, as we've had for a number of years, and again, the difference in this instance will be a shift to digital parking passes that will kind of feed into that contactless experience I was describing earlier.
Okay, let's talk a little bit about the golf. The tournament is sandwiched between the Arnold Palmer and the Honda Classic, and about a month away from the Masters. What type of field are you looking for? I know that this is called traditionally the fifth major, right? And what type of field do you think you're going to get this year with all of the adjustments to COVID? The golfers are ready to golf, so you should be out there with some of the best golfers in the world, correct?
Yes, and speaking of which, Charles, I don't want to let you off the hook, but I did want to mention that you were on the winning team in a recent event that we had with some of our local media around. I was trying to get out.
I was trying to get out of this, but I appreciate it.
So I hope you're wearing your Goldman socks that were a part of the gift for the winning team. But relative to the competition, I think from when you look at what's happened over the course of again the last 40 weeks, we are very fortunate in that there has been a significant uptake in the game of golf. So as an industry, we're seeing a lot more people playing golf. All the ways in which you can engage with the PGA Tour, whether it's through social and digital media, PGA Tour Live, our streaming product, our relationships with DraftKings and FanDuel and others in states where online sports betting is legal. The engagements around the sport have been unbelievable. Just some great responses. And you're right, the players are anxious to play. This is the Florida Swing is a very traditional part of their schedule, and there's a lot of great players rounding into form. And this is a tournament that they look forward to every year. And some of the comments from Rory as of late and the top players in the world would certainly supports that. So if they're healthy, they're going to be here, and we're going to have once again the best field in golf. Period.
Okay. All right. Well, we appreciate all the work that you're doing out there, and we're looking forward to some great golf in 34 days and a few hours. And we appreciate all the work that you do for the community as well.
Well, thank you. Appreciate you having me on. And again, to your listeners, we wouldn't be able to do this without their support. And look forward to seeing those that are out here in a few short weeks. And look forward to catching up soon.
Thank you very much. Jared Rice, Executive Director of the Players. We'll be right back in a moment.
In celebration of Henry Louis Gates Jr.'s new documentary, The Black Church, WJCT is collecting stories and memories of your experiences. What does the Black Church mean to you? What role has it played in your life? Share your thoughts and memories and have your stories archived for future generations. Visit wjct.org/blackchurch for instructions.
China's manufacturing sector is growing pretty good. American factories, on the other hand, not so much.
I'm not especially worried that, my tennis sneakers are made in China. I am concerned about the future of the aircraft industry, of the telecommunications sector.
I'm Kai Rizdal, both sides of the all-important Sino-American manufacturing relationship. Next time on Marketplace.
Tonight at 6, here on WJCT News 89.9.
When you think of the mob, you probably think of The Godfather and tabloid murders. On the next Fresh Air, Russell Shorto explains there were mob families in small cities all over America. His new memoir, Small Time, is about his grandfather, a mob boss in Johnstown, Pennsylvania. There are rackets, political payoffs, and an unsolved murder. Join us.
Today at noon on WJCT News 89.9.
President Biden wants schools to reopen within 100 days, but his own health officials have cast doubt on that goal. Fights between some districts and teachers' unions are already complicating plans. Is this one test the country cannot afford to fail? Making up for lost time and making the classroom safe for students and their teachers. Next time on 1A.
Today starting at 10 on WJCT News 89.9.
Welcome back. Florida Prepaid College Savings Plan started its annual open enrollment window yesterday, and it runs through April 30th. This is the only time each year that families can look into the pricing of the prepaid tuition plan and prepaid dormitory plans. Shannon Colavecchio of Florida Prepaid is on the line now with more on the program and why parents should consider it. Good morning.
Good morning.
How are you doing?
I am doing great. Thank you.
Great. This is a really popular thing. Florida Prepaid is very popular. I used to have it for my kids when they were very young and in school age. And I tell you what, this is one of the best investments. I'm going to go on record. This is one of the best investments a parent can make. Going out and getting more information about Florida Prepaid. Can you tell us? What is the best thing about this program and why is it so important for parents to learn about it so early?
Absolutely. Yeah. Well, first of all, I'm so glad to hear your story. We hear that over and over again, and it just reminds us to how important our mission is. And, the thing about a Florida Prepaid college plan is that it really does make college savings accessible, affordable, and simple. So you essentially just pick the plan that fits your savings goals and your budget. You're basically locking in the future cost of college for less, and it works in a way in that you are prepaying future tuition and most fees in monthly installments, or you could do a lump sum payment. The great thing is that you do not have to worry about how much college costs are going to go up in the future, or even like the ups and downs of the stock market, because that's on us to manage at Florida Prepaid. And we guarantee that when it's time for your child to attend college, their tuition is covered. So it just offers great peace of mind and a way for families to start saving early in a way that fits their budget.
So I think the primary question for parents is, how does it work? I mean, what's different from this than a certain type of account or savings account that parents can, they start saving early. They might use larger sums of money at different points in the child's life or what have you. But what makes this? What are the nuts and bolts of it? How does this thing work?
Well, again, so the way this works is, so number one, I think part of what makes this different is the track record here. So we've been around for over 30 years, and we're actually the largest and the longest running program in the nation. And it's something that is unique as a benefit to Floridians. So it's really, I tell people it's like a hidden gem because you can only take advantage of this if you live in Florida and are a resident. And the way that this program works is we set month or payment plans we set plan prices every year based on a few factors. What is current tuition in colleges and universities in Florida? What do we think it will be moving forward? And then a slight amount of an investment yield. Our actuaries take care of all that. When we set those prices every year during the open enrollment window, that essentially offers to a family, we say, this is the price of your plan. You can pay it in monthly installments. This year it starts at $45 a month for a newborn, which I joke to people, it's like a Starbucks budget. And so what you can do is you can choose the plan based on the monthly payments that you can afford. And a few things happen that make this different. This is not like a bank savings account where you're just putting it in there and hoping that you have enough by the time the child goes. When you lock in a prepaid plan this year, right, you essentially are locking in the guarantee that no matter what happens to tuition or the trends of the market moving forward, when it is time for your college to go to tuition, simply by making those monthly payments that will never go up, they'll always be the same price. By making those, you are guaranteeing that their tuition is going to be covered. And that is a guarantee that comes from the state of Florida, right? And so you can never lose the money that you put in. It is guaranteed and it's there. It's also a tax benefit, right? So this is a tax-free way to save. That is not true if you're just using like a bank savings account. So there's that. And I think also the thing that people don't realize maybe is just the flexibility of these plans, because sometimes we hear from parents that, they're hesitant to save because they don't know yet what their 3-year-old is going to do, right? And none of us do. And so, but the great thing about our plans is that they're actually built to be flexible. So if you buy a certain plan and then don't use it, you can get a full refund, or you can apply the amount of that plan toward a different scenario of college.
Okay, so we've got a little less than a minute left. Tell us where people can get more information. Where should they go to get more information?
Yeah, so you can go to myfloridaprepaid.com. And if you have a child, I encourage you to use the pricing calculator that is on that website. You can plug in their birth date, and then it will tell you based on their age exactly what each of our 5 plans and dormitory plan would cost per month based on their age. And so that will give you a good idea of what you can afford.
Okay, very good. We appreciate that. And we're looking forward to more from the Florida Prepaid program. Certainly a useful tool for those parents out there trying to save for their students' children's college future. Thank you very much, Shannon, for that important information.
Thank you. Have a great day.
All right. And that's our program. Thanks to all of our guests and callers. Our producer is Heather Schatz. Josh Torres is our director. Thank you, Josh, for always helping me out. Our news director is Jessica Palumbo, and Bill Bortsfield is our digital editor. If you have questions or comments about First Coast Connect, send an email to firstcoastconnect@wjct.org. I'm Charles Griggs, sitting in for Melissa Ross, and you're listening to First Coast Connect on WJCT 89.9 Jacksonville. We'll be back at 9 a.m. tomorrow, but if you missed anything, you can listen to a replay 8 p.m. tonight or WJCT.org or on your favorite podcast platform. Have a great day.
Support for First Coast Connect is provided by Baptist